A patient goes from having a fear that they could lose their teeth. I hear it a lot, their fear about seeing grandma with their dentures in the cup, by the sink, and I never want to end up like that. In the early years, we thought that if we took out someone's teeth when they were 20 or 30 years old, they had decay, they weren't taking care of it, they had what the term used to be soft teeth. So the dentist would take all the teeth out with the thought that this ridge is going to be so good that the dentures are going to hold beautifully. What we didn't know back then is 20 years later, the patient can't wear the dentures because they've worn the ridges down from the constant abrasion of wearing them. And then the patient later on in life, in their 50s and 60s or even 70s, are having a hard time being able to wear anything. They're not very happy. They've adjusted their eating habits, so they're eating very soft foods. They certainly don't have the joy of going in and biting into something and being able to chew it well. So that was a misunderstanding, I think, back in those days. I think the pendulum has swung so far that if a person can afford it, if they've lost their teeth, they should always have an implant to preserve the bone. You look 20 years later, you're going to have the same ridge there that you had when you first put the implants in. I wish there was an easier issue with the economic side of it, but it's definitely the way to go. Many times patients will ask, why should I go through all of this in having implants put in? It's costly, there's discomfort involved with it. I think it is a lifelong investment, and yes, it is costly on the front end. But when you look over 5, 10, 15, 20, 25 years, you're going to look back and say that's probably one of the better things that I ever did. But there is that initial, wow, those are expensive compared to not having any implants in at all. But the consequences that you pay later on in life are excessive. The question is, are all dental implants the same? It appears that we have finally reached the point of design that most of the implants have a nice, surface. It's predictable. The engineering aspects of it, I believe that there's some that are superior to others, and I use some that are more expensive, and there's a reason why it's more expensive. But the predictability of every time I use it, that the parts always fit together correctly. I don't have to throw one in the corner and pick another one because it wasn't, manufactured right. But I think all of us have our favorites. We either grew up with it from the beginning, or we switched around and finally held on to one. Patients really, I think, get the benefit of what a healthy mouth is, and once they're there, they really don't want to give that up. They know that it's important to the rest of their health.